President of Thai Medical Informatics Association, International Representative of TMI for International Medical Informatics Association, and a member of the Thai Medical Council and Royal College of Physicians of Thailand. Today, Dr. Raymond Francis Sarmiento, who is the Director of the National Telehealth Center, National Institutes of Health, University of the Philippines, Manila, and was previously the Chief Research Informatics Officer of the Center. Dr. Sarmiento also serves as the Chief Data Protection Officer of the University of the Philippines, Manila. He is also a lab expert at the Standards and Interoperability Lab for Asia. We will now call on our speaker, Dr. Buntay.
Hello. Hello. Can you hear me well?
Yes, we can hear you well, Dr. Buntay.
Okay. I think everyone can see my presentation now, right?
Yes, but can you switch to the screen mode, Dr. Buntay?
Yes. Right now, I'm showing my first page of my presentation, and I think everyone can see here. And good afternoon, everyone. And it's a very a good day today, and I'm quite exciting to do the webinar with you. And then I will do the talking about 30 minutes, and then Dr. Raymond will come and help me talking about what our experience is. And then we will have around 10 to 15 minute session of question and answer. So today our webinar topic is about the AeHIN Health IT Collaboration Workshop and Conference 2017. What is the AeHIN IT Collaboration Workshop or Conference? I define it as the conference and workshop that our network, Asian eHealth Information Network, work with the governments, academic institute, or other organizations in several countries to organize international eHealth and health IT workshop and conference. What we do is that some conference we suggest the workshop topic and content. They come and talk to us about this, about the topic, and we discuss together, organizing those. Another way that we collaborate with another countries or institute is that we recommend our network members as a speaker, so we can identify who are the expert in our network. So we recommend them, and then they are invited. Another way is that we work is we recommend the AeHIN member as a participant. And some workshop and collaboration, we also finding some financial support for the AeHIN member to participate. In 2017, we have this kind of activities that I'm involved at least 3 activities. The first one is the ASEAN-Japan Healthcare ICT Forum. It's in early of this year, in February, and we do in 5 days. The organizer of this conference is one of the NGO in Japan called the BHN, Benefit Health Need. They work with the Ministry of Health and Welfare of Japan government, and they talking with the ASEAN Secretariat, and then we 3 of party like the ASEAN, Japan, BHN, and AeHIN. Now we then we organizing the topic and what topic that we would like to do. I will go on detail about this forum later. The second one is the WHO AeHIN Center for Health Statistics and Informatics e-health meetings. This is a pre-conference at the China Health Information and Technology Exchange Conference. This is a very big conference in China. This occurred in Qingdao, China, in May this year. This pre-conference, actually we actively organizing this, and we get support from WHO Western Pacific region organization with the support from the Nordic or Norway International Cooperation for funding. So in this pre-conference, and let our AeHIN member to attend the big conference in China are partial support by the financial support from the Nordic Foundation or Nordic International Foundations through the WHO Wipro Regional Office. The third one is just this June. This is called the Asian Health IT Collaboration Workshop. This is kind of the small workshop organized by one of the university in Taipei, Taiwan. One of our AeHIN member, Professor Shin Yi Su, he organizing this, and then we work together to invite some of the speaker in our network to come and share with the Taiwan health professional, health IT professional. Let me starting with the first one. The first one is more formal. Actually, the one who organizing this is the BHN and Japan Telemedicine Telecare Association with the support from the Ministry of Health, Labor and Welfare Japan. And ASEAN is the party that working with the Japan side. ASEAN has we call the Japan ASEAN Integration Fund, which the Japan support ASEAN through this fund. So this conference is more formal, but the one who operate this is the BHN. We as a network AeHIN collaborate with them. So the limitation of this conference is that only the ASEAN countries member will be invited. So part of the invitee will be selected by the ASEAN and Japan. Part is recommended by our network. So we use this kind of the collaboration to be the exchange platform with the Japan partner and Japan Ministry of Health at Japan. And we also have get several news AeHIN member from our ASEAN country like Brunei. So this is proposed by the Thailand and Japan. It has to be proposed by one of the ASEAN country. We take advantage that we are in our network. We have a lot of people in Ministry of Health in ASEAN. So I working with the Ministry of Health and also with the Ministry of Health of Japan, then propose to the ASEAN community. And you can see that there is at least 4 organizations that working or organizing this. What I mean organizing is that we identify the topic, we identify what would be the good experience from the health professional, health IT professional, especially from the Ministry of Health of ASEAN. We will be learned from Japan, and Japan also helping identify the expert and also the site that we can visit. And this is the funded by the ASEAN Japan Integration Fund. So the invitation will go through ASEAN Secretariat to the country. You can see that this is a forum objective to share and exchange health IT and e-health knowledge and experience among Japan and ASEAN member states. Like I say, this is limit only for the ASEAN 10 member states. And all among 10 member states, 8 countries participate. The country that not participate is the Singapore and Vietnam. For the Vietnam, the notification is too short. They cannot get the arranged to go. So they the people, our AeHIN member who work in Ministry of Health, quite disappointed that they cannot go. But for the Singapore, they also have I think they are very busy, so they decline in the first place. And in this forum, among ASEAN countries, there is 28 participants, and we also have Jai Ganesh. If you remember, Jai Ganesh is one of the general committees and working council, and he is the expert in the telemedicine and health information system in South India. So he also was invited to be one of the speakers in the forum. From the Japan side, there has many local participants participate in this forum, and the schedule that we spend half of the time in Tokyo doing the discussion and then exchange. So in AeHIN side, we do the presentation, introduce our activity in the country like Philippines, talking about the telemedicine and also the governance system in telemedicine. Thailand, talking about the exchange about the standard and interoperability activities. Malaysia also talking about their health information system in the Ministry of Health development, etc. And in this forum, we are very happy that we can have a new active AeHIN country member, that is Brunei Darussalam. Mr. Paul, who is the chief of the ICT from the Ministry of Health, Brunei Darussalam, also joined us and agreed to work as the working council of our network. And in another 2 days, we have a site visit to several places to see how the health IT and e-health activities or the advancement of the Japan. We have an opportunity to visit several places, both in Tokyo and also in Kagawa Prefecture. Kagawa Prefecture is at the southwest of Tokyo. So this forum also composed of the presentation, conference, and also site visit. This is the number. This is the name of the AeHIN members that participate in this forum. You can see that this is around 15, about 13 people that is be our member, but there is 20 another that they just new for the to the member, and this is the opportunity that we can get more people into our network. And most of the people that get into the network is working at the Ministry of Health in ASEAN countries. So this is the output of the forum. We learn and discuss about the need of the ASEAN member countries that we can identify, and also discuss about the opportunity that we can work with the Japan, and at the forum, both Japan and ASEAN side, we decide to announce the call for actions in ASEAN, and this is the summary of the call for action. At the forum, our network, we discuss about our framework of the development of national health information system. I think many of you are familiar with what we call the GAPS framework. This is the knowledge that we accumulate and then forming the framework or the model that to develop the national health information system or e-health in the country. We have to work on at least 4 areas: the governance, the architecture, the program people and program management, and the standard and interoperability. So first, we mind the gap. We have to aware that these 4 topic is the key topic to build or to develop the national health information system. And then now we are talking about how we to get there, how we to have an effective national health information system. So we try to fill the gap. And this is the framework that originate from our network. So this is what we mean by GAPS framework: the governance, the architecture, the people and program management, which is that ICT in healthcare require capacity building in key sector, both clinical, IT, admin, and working, and know about the project management. And to have the interoperable of the health information system in the country, we need standard and interoperabilities. The governance and architecture is the first priority things that the country should do. We should have a good governance body for the health IT. And if you remember, and if you participate in the several past AeHIN general meeting, you can see that in our network, we're talking a lot on governance, about how to do the blueprint or the architectures. So this is the 4 key topics that we identify, and we think to build the national health information system or e-health from the in the country, we should working on this area. At the forum, at the last day of the forum, we have a meeting between Japan and participants from Japanese participant, and also the organizing from Japan and organizing from AeHIN and ASEAN, and also the participants come up with we call the call for action, and we do the formal documentation and propose this to the ASEAN communities. And if you are interested in this document, we can, I think we have put it in our repository, so you can look at what we propose to the ASEAN. And this is the 4 area call for action for the stakeholder in ASEAN to first develop capacity for health IT, ICT in ASEAN. We have two suggestions. One, to create ASEAN regional guideline for minimal requirement for training and accredit for the health ICT in healthcare and ICT and administration. The second suggestion is that integrate appropriate and ethical use of the health ICT in enhancing existing health program in the post-2015 health agenda. The second call for action is that organize regular annual fora or forum on the health ICT. In this forum, everyone said that we should do this every year if we can find the opportunity and if we can find the funding to do that. So this is one of another call for action that we propose to the ASEAN communities. The third one is the talking about the engage a common collaboration health ICT and telehealth projects among ASEAN countries, working together, learning together on the health ICT and telehealth projects. The third one is that to craft a regulatory framework for the health ICT, and also the responsibility for which one it should be the government, should be nurtured by private. And so to say that we should promote the public-private partnership and working on the framework, how we gonna work together. And this is the four actions item that we propose to the ASEAN. And after this, I think the ASEAN, the high level, the SOM or the senior officer of in health in ASEAN get this report and recognize this. And we hope that in the next 2-3 years, ASEAN will be more working on the health ICT, and our network will facilitate and working with the ASEAN community, ASEAN Secretariat to work more on the health IT. So that is the first AeHIN health IT collaboration that we do with Japan in February. The second one, this is the one that we actually organizing with the WHO Wipro. We call the WHO AeHIN Center for Health Statistics and Informatics e-health meeting. This is the P-conference meeting, and the one that invited the participant is WHO, Wipro, and AeHIN, and the China Ministry of Health organizing the venue, and also but the support, the logistic support is by the AeHIN and Wipro. So you can see Mr. Chung Gao, the representative of the health IT officers in the WHO Wipro, is one that supporting this event. And also you can see Ms. Kirti from ADB. ADB also participate in this, but the representative from each country, this is the representative that come to that P conference. You can see that we have Cambodia, Mongolia, Australia. The Professor Xiao Teng Liao, if you remember that he is the one that leading the research group in AeHIN, and Malaysia, Ministry of Health Malaysia, and 3 from Vietnam, and 1 from Philippines, and 1 from Thailand. And this is the meeting objective is that we want to share and learn between the China and also in the ASEAN AeHIN member countries. And then if the time and if we can get some kind of the guideline, recommend the next collaborating, working with another, with each other, that would be another next step that we would like to have in this meeting. So what we talk and what we discuss in the workshop, this P-conference workshop only one day in 18 May, and it's composed of the country presentation about update the development of the health information system for each countries. ADB also talking about the policy that they are working on the digital health, and we're talking about how we're gonna establish the e-health research capacity in ASEAN. And in this forum, I also have the opportunity to mention about the fill the gap and mind the gap and fill the gap. And we are identify activities that we could do to fill the gap. The next day of this will be is a very big conference. You can see in this picture that the local Chinese, this is the big China Health IT conference. They call the China Health Information Technology Exchange Conference. Is organized by the Ministry of Health of China. Actually, it is the one that organizing this is the Center of Health Statistics and Informatics, which is collaborating closely with our network AeHIN. And this conference is a big one. The Vice Minister of Health came and opened and then give the remark and also talking about the China Health IT plan. So it is around 3,000 to 4,000 local participants. And at this conference, we have 5 minutes to introduce our AeHIN to the audience, which is, I think, is good that we are now have more our big one of the big country that is very advanced. In this conference, we saw a lot of the advancement in China. So next time we can, if we can work and work with China, then we can learn a lot from each other. Both China learn from us and we learn from China. The last one that I help organizing this is called ASEAN Asia Health IT Collaborating Workshop. The Professor Chen Yi Su in the red circle in the right hand side in your screen. He is one of the AeHIN member, and he is actively working with our network and then organizing this small, very intensive and intimate workshop. It's more than it's not a big conference or meeting, but we learn a lot from this. And because of the limitation of the funding, the Taiwan only can invite or support 6 of the AeHIN member and have to be the speaker to exchange with Taiwan. So Professor Chen Yi Su is the president of the Taiwan eHealth Association and also the National Taipei University of Nursing and Health Science. And we do this. And you can see that there is the PhD graduate and student in behind, from one from Africa, one from Pakistan. They are also the studying in Taiwan, and then come and be part of this conference. And this is the AeHIN member that participate in this conference. I think Dr. Raymond can help more insight about this workshop that we done with Taiwan. We learn a lot. The objective of this workshop is that to exchange the knowledge and experience between AeHIN member country and Taiwan. The second thing is that we want to learn about the famous Taiwan Health Insurance System and Taiwan Center for Disease Control and Prevention, or the surveillance system in Taiwan, which is one of the famous best practice. The third one is that we discuss about the future collaboration between Taiwan and a country in ASEAN. Right now in Taiwan, Taiwanese government, they have a policy called the Look South policy, which means that they want to be more working collaboratingly, economic and social, especially health IT area with the country in South Asia, which is includes Southeast Asia and South Asia. So this opportunity that we talking about the next possible collaborating activity. It can be the doing the workshop in one of our ASEAN Asia South Asia country. Invite the expert from Taiwan to come and talking about the advancement. So what we do, this is a small workshop, but we have a 4 days. First 2 days we talking and exchange about the several topics, like talking about the health ecosystem in Malaysia, how we're gonna rethink to form the new healthcare system, the health information exchange in Thailand, and also the telehealth, telemedicine implementation in India, in Philippines, and also the Professor Lufan from Indonesia are talking about the public health preparedness in Indonesia. For the Taiwan show us a lot of their advancement in health IT, the robotic, the telemedicine. We have an opportunity to see the real health information system, a hospital information system in one of the big healthcare system in Taiwan. And we also visit the National Health Command Center, or the big surveillance center at the center of the disease control, Ministry of Health and Welfare. And we also have the opportunity half day learn about the National Health Insurance Administration and universal healthcare coverage in Taiwan. To myself, I learned a lot from this site visit, and I think this is the opportunity that this is got opportunity that we should do this with more advanced country or the developed country, and we can learn from that and come to working with our countries. And you can see that they show us the robot that working in the senior home, and also the health information system, hospital information system. The picture on the left hand side, this is the war room in the command center of the Ministry of Health when they have epidemics, spread of the disease, and they can have all the meeting here and see what happened and how to do the strategy and also the plan to curb this kind of the epidemics. And we visit the National Health Insurance Administration, learning about their insurance system, how the information system integrate or use, and also the develop under the National Health Insurance System. Taiwan has one of the famous National Health Insurance System. They reach the Taiwanese reach the universal healthcare coverage since 1996, and they can the health care service is quite good. People in Taiwan are satisfied with their healthcare system. So the lesson learned that we learned from Taiwan is that Taiwan invests on the developing foundation and national health information system in a very early phase since 1990. And the success of the implementation of the single-payer universal health insurance system both need and contribute to the country effective integrated national health information system. They can provide the health information to citizens. So if you are the Taiwanese citizen, you can get your personal health record, which is from the information that centralized and gather integrate at the National Health Insurance Administration. they have the centralized system, and they also implement the health data standardization. That these enable Taiwan to integrate information, health information from all the providers and their partner. They also have a lot of the communication between the ministry that very important for the implement and success of the healthcare initiative. The third one is that they have a very conducive ecosystem, both at the Ministry of Health and the National Health Insurance Administration, and with the private sector. So all of these enable Taiwan to be very success in integration and interoperable of the health e-health system. So if you want to learn more, and this is the web, we saw the video conference about their national health insurance system, and they luckily they put it in the YouTube. So if you follow this, you can learn about the Taiwan National Health Insurance System. And My Health Bank is a personal health record. They also post about the development of the personal health record in the YouTube. So you can, if you want and interested to learn about Taiwan, you can watch that. The third one that I think this is a very good report from the Commonwealth Fund, that we learn a lot from the healthcare system in many countries. This report, they're talking about the healthcare system in Japan and also in Singapore and in Taiwan, which is in our ASEAN. And if you want to compare and contrast with European and the United States, this report also a very good one. So I will finish my presentation now. I think I make quite a good time. Any questions?
Are there any questions from the audience?
Oh, let me introduce. This is Dr. Raymond. Dr. Raymond participate in ASEAN Health ICT workshop, a collaborating workshop in Taiwan. And think, Dr. Raymond, you can talk more on these activities.
Thank you, Dr. Bunchai. So a lot of the lessons learned that we got from Taiwan really focuses on the advancements that they have had in the field of e-health. Dr. Bunchai has touched on a lot of the things, especially on the centralized way and the focused way that they implement their e-health programs. And primarily what impressed us was their close collaboration of the academe with those from the private sector. We were exposed to a whole lot of commercial vendors and private sector stakeholders, ASUS, Acer, and several other partners from the private sector who were able to showcase their own innovations for health IT, and not just for devices, but also in the way that they are using standards as part of the Fill the Gaps, Mind the Gaps framework, and to be able to advance health IT in the region. Several items that several things that we also learned and was very much appreciated was how, especially for developing countries, how Taiwan serves as an inspiration for other AeHIN member countries to be able to move forward with their e-health implementations. One of those was that the status of for electronic health records or electronic national health insurance is that in Taiwan, everyone carries an electronic NHI card with a unique personal health identifier. We actually had a deeper appreciation for the value of unique health identifier for citizens and especially for everyone in Taiwan, and it made it more the implementation and administration of care in the country. It made it seem simpler and more efficient, and the administrative costs accounted for just 1.07% of the total expenditures, national health insurance expenditures in 2014. So other items that we also learned was that the important innovations and reforms in Taiwan's single-payer health insurance system include the global budget system, a DRG payment for hospitals, a paper for performance, the NHI card, as I mentioned, the Farm Cloud, and My Health Bank, and various other initiatives that the National Health Insurance program over at Taiwan and the folks over at Taiwan actually were able to share with us. Other things that we would want to emulate, especially for the Philippines and other AeHIN member countries, will be having their own dedicated centers for disease control and prevention, which actually has a post tie-up or partnership with the U.S. Centers for Disease Control, and they have been able to sort of replicate the best practices and lessons learned, especially for handling disasters and crises and emergency situations and health emergency situations in Taiwan. A major reform bearing special attention also is the second generation NHI reform, which imposed a supplementary premium on 6 non-payroll sources of income. Other items that we will want to also share with other AeHIN friends and other AeHIN member countries will be the fact that even if a hospital is found in, let's say, in the remotest areas or geographically isolated areas, they are in fact very much advanced in terms of having their own universal, so to speak, hospital information system that's fully integrated within their national health insurance program, and the heavy use and implementation of standards such as HL7, the clinical document architecture, and sort of a new branch off from that, which is the Green CBA. So those are the lessons learned that we were able to gather during our stay in Taiwan during the last week of June. And if you have any questions for Dr. Bunchai and I, will be happy to answer them.
Thank you, Dr. Bunchai and Dr. Raymond. We have a question here. It reads, what can we expect from the project with Professor Su, and is it possible for AeHIN members to obtain PhD or other opportunities to train in Taiwan?
Do you want to answer that, Dr. Bunchai?
Char, could you repeat again? What I understand from the question is that how we gonna work with Professor Chi-Ying Su, right, in the next kind of the next year, next 2 years. But the second part, what is the second part?
Is it possible for AeHIN members to obtain PhD or other opportunities to train in Taiwan?
Let me talking about the look south policy in Taiwan. Right now, I think the Professor Chi-Ying Su, he working at the academics in the university. So he proposed a project to work with the to work with the country in ASEAN and Southeast ASEAN. And we starting work talking about it by looking that we should starting with the workshop or the small meeting, and then with the support from the Taiwanese government, we can get 5 AeHIN members to go there, discuss with the group, Professor Su Group that work in the health IT. And then this year, the good news that I learned from Professor Zhu is that he also get a new grant from the government to continue the activity. So I think it is possible that several possibilities that we can do with these kind of the with new grant. First is that Taiwan is very I mean, they have a lot of experience on the standard and interoperabilities, like the identification, citizen ID, the green CDA, clinical document architectures, the HL7, and they have an expert on this area. So it is possible that we might do a workshop, invited the expert from Taiwan, and then we gather all the gather the AeHIN member in one country, maybe like in Cambodia or in Vietnam or in Bangkok or in Kuala Lumpur, and then we can work learn this in 2 or 3 days. But if we don't have enough money from that activity, it will be possible also that we will invite the expert from Taiwan to come to do the pre-conference workshop. We will have a general meeting anyway, right? Every year we will do the general meeting, so we can arrange the pre-conference workshop, looking for the I mean the good topic that we all need in our communities. And then let the experts from, I think not only Taiwan, but also Japan, like Professor Shinji from Kyoto University, that work a lot on the open EHR, can come and do the pre-conference workshop for us. Raymond, you have more comments on that?
Just nothing so much, but to add that in addition to having an HL7 workshop with a focus on CDA and green CDA, we have also engaged Dr. Munchai's group for the Thai medicine's terminology, and to be able to merge sort of those two topics together in a singular event or workshop to be able to build the capacity of 80 member countries, and we hope to be able to conduct that joint HL7 and terminology workshop in the first quarter of 2018.
Okay. Any additional questions, Cha?
Yes, Dr. Bunchai, we have a question for Dr. Raymond. It reads, are you interested in the same industry-academic collaboration similar to what we saw outside our country? How do we initiate it here?
So thank you for the question. So the short answer is yes. Obviously, we are looking for more and more opportunities to be able to have academic institutions expand the reach beyond the 4 walls of the academe in terms of strengthening partnerships with those from the private sector. I think that's valuable, especially since over the years the academe, especially here in the Philippines, has had more of an inclination to seriously work together with the government sector. But I think to be able to advance e-health and digital health in a countrywide approach, it will take every stakeholder from every side, not just from the academe, from the research side, from the government, but more importantly also to be able to reach out to our private sector industry partners. I will be happy to reach out to anyone from the industry and to be able to initiate the talks in order to be able to move forward on this. I also have a similar question to Dr. Bunchai and how this is actually being done in Thailand. How does the academy relate to private sector or industry partners, and how is it similar to how they are doing it in Taiwan, Dr. Bunchai?
Yes, thank you, Raymond. You know, right now in Thailand, a lot of healthcare startup are very active, and it's starting to be have a conversation and collaboration between academia and also the Ministry of Health. Right now in this stage, it's more on the knowledge exchange rather than working into the specific project. It seems like the startup is very active, so they most of the startup are more the ICT side, so they need kind of the context. So the academe, the Ministry of Health, and also my research institutes also get involved in this kind of the activity. But I think this is a good time that we should work both with private sector, especially a lot of startups are now emerging in many countries. I saw the statistic, both Philippines, Malaysia, Indonesia also has a lot of the startup group. For example, I think several people are talking about the blockchain technology to kind of the working in healthcare for the privacy and confidentialities or the smart contact. I think this is a good, good time that we will work with that. I saw Dr. No in the participant. Dr. No is also one that participate and in the AeHIN Chai-Tech's pre-conference workshop in China. Cha, can you unmute Dr. No? And I would like Dr. No to talking about the experience and what should we do next with our neighbor like Japan, China, and Taiwan. Over to Dr. No. Hello, Dr. No, can you hear us? You can speak now. Hello? You don't have microphone?
Yes.
I think Dr. No don't have the microphone. I think. Yeah, Dr. No is a very active young AeHIN member. And she a very active lady and working with Dr. Fasila in Malaysia, and we had a very good time in China together. I saw Alvin, Dr. Alvin Marciero, and Mean. Any comment from Alvin and Dr. Sombat, and also Win?
Dr. Bunchai, this is Alvin.
Yes, thank you.
Good afternoon, everyone. Dr. Raymond, good afternoon.
Afternoon.
Thank you for sharing your experience in Taiwan. I'm really very interested in how much closely we can work with the Taiwan academic and industry partnerships, because I think they've gotten the academe, industry partnership, and government done very well. And that's why they're very ahead in terms of manufacturing and in terms of intellectual property. In the Philippines, it's a little lopsided. The industry is not yet partnering very closely with academia, vice versa. And I think we're missing out on a lot of opportunities for economic benefit for the whole country until we do that. So in September, we're having academe industry partnership meeting funded by USAID, but that's still, I think, artificial because it's coming from outside rather than coming from inside, coming from within. So that's why I was asking what would be the next steps with Taiwan. Is there another meeting? Will there be, I mean, even if it's a small group, so that we can keep the momentum over? Back to you, Dr. Raymond, Dr. Bunchai.
Do you have anything to add, Ms. Wing?
Oh, let me respond first, Dr. Lemon.
Go ahead, Dr. Chai.
Okay, I forgot to mention something that in that workshop, we individually do the MOU with the Taiwan E-Health Association, which Dr. Professor Su is the president. And also we are working on the MOU, the Memorandum of Understanding between the AeHIN and the National Taipei University Nursing and Health Science. So it for the momentum of this is that we will waiting for Dr. Professor Su that how well they how the propose that they propose to the government to get the next grant to do the activity with us. So after that, then we will look at the opportunity to work with, like, identify the workshop or even the working with some private company in Taiwan. At this time, you know, we see a lot of I mean the machine and the equipment and they use more advanced than in our developing country. It is a very good experience to see how they are working between the private and public. Over.
Thank you, Dr. Bunchai and Dr. Raymond. We do not have questions left. We would like to thank all our participants who actively participated in this webinar. We would also like to take this opportunity to invite you all to tomorrow's webinar on Sale Data Bank with Dr. David Ford. Thank you so much, Dr. Bunchai and Dr. Raymond.
Thank you.
Thank you. Thank you.